Hello everyone. Now let us learn about the anatomy of the thyroid gland. As we all know, it is a highly vascular and ductless endocrine gland which is present in the front on either sides of the trachea. It is located opposite to the vertebral levels of C5, C6, C7 and T1. Extent of the thyroid gland is the upper extent is the oblique line of the thyroid cartilage, whereas the lower extent is the 5th to 6th tracheal ring. That is the oblique line of thyroid cartilage, and this is the 5th to 6th tracheal ring. Parts of the thyroid gland. Let us see about the coverings first. There are two coverings, the inner true capsule and the outer false capsule. The inner true capsule is formed by the condensation of the stroma of the thyroid gland, whereas the outer false capsule is merely formed by splitting of the pretracheal fascia, which encloses the thyroid gland and goes above. Ligament of Berry. The pretracheal fascia is thickened at the level of the cricoid cartilage and gets attached to it from the medial surface of the thyroid gland. Due to this, the thyroid gland moves up and down during deglutition. It is also called a suspensory ligament of thyroid. This helps in differentiating between the neck tumors, where the thyroid gland moves with deglutition but the neck tumors do not. Now, let us see about the structures present between the true and false capsules. At the posterior border of thyroid gland, we can see 4 parathyroid glands and trunk of blood vessels at the junction between the true and false capsules. Linked to the true capsule, we can also see venous plexuses. The removal of the thyroid gland must be done along with the true capsule. False capsule is thin on the posterior aspect of the thyroid gland. Thus, tumors which occur here a lot compress the posterior structures without any swelling on the anterior surface. The shape of the thyroid gland is head-shaped, whereas the single lobe shape is pyramidal. The parts are 2 lateral lobes and 1 isthmus. It weighs approximately 20 grams. Let us see about the lateral lobe. The lateral lobe has apex, base, 3 surfaces, and 2 borders. The surfaces are the anterolateral surface, or also called the superficial surface, medial surface, and the posterolateral surface. The borders are the anterior and posterior borders. Let us see about the apex. It is the upper projecting part which extends to the oblique line of the thyroid cartilage. It is sandwiched between 2 muscles, medially the inferior constrictor and laterally the sternothyroid. Thus, the thyroid gland cannot extend above the oblique line due to limitation by the above 2 muscles. In the diagram below, we can see that the apex is narrowed above and the base is the one that is expanded below. It is the lateral view. Right side muscle is the inferior constrictor and the left side one is the sternothyroid. The relations of the apex are, it is related to the superior thyroid artery and the external laryngeal nerve. Both travel together up to the apex. After crossing the apex, the superior thyroid artery goes superficially and external laryngeal nerve goes deep. Thus, ligature of this artery must be done close to the gland. Let's see about the base. It is the expanded part which is present near the 5th to 6th tracheal rings. The relations of the base are the inferior thyroid artery and the recurrent laryngeal nerve. The inferior thyroid artery, it forms a loop behind the base, and the recurrent laryngeal nerve ascends upwards, either within the loop of the inferior thyroid artery, or in front of the loop, or within the branches. Thus, ligation of the inferior thyroid artery must be done away from the gland. Ligation of the nerve, recurrent laryngeal nerve, by mistake leads to hoarseness of voice. Let us now see about the anterior border. It separates the anterolateral surface from the medial surface. It is related to the anterior descending branch of the superior thyroid artery, which forms an anastomosis with the fellow artery of opposite side, which forms the midline anastomosis. Posterior border of the thyroid gland forms and is related to the anastomosis between the superior and inferior thyroid arteries. Parathyroid glands are seen at the posterior border. Superior parathyroid glands present at the level of C6 near the cricoid cartilage. Inferior parathyroid glands seen a little above the lower pole of the thyroid gland at the level of T1. Let us see about the isthmus. It acts as a connecting bridge which is present anterior to the tracheal rings. There are two surfaces and two borders. The surfaces are anterior and posterior, and the borders are upper and lower borders. Its vertical length is approximately 2.5 centimeters. Its relations are anteriorly it is related to the capsules, sternohyoid and sternothyroid muscles, investing layer of the deep cervical fascia, the anterior jugular vein, superficial fascia, and the skin. Posteriorly, it is related to the second, third, and fourth tracheal rings. The blood supply of the thyroid gland. Arterial supply. The arterial supply is by three arteries. Superior thyroid artery. It is the first branch of external carotid artery. It runs towards the apex and goes superficial. It supplies the superficial surface of the gland. Next is the inferior thyroid artery. It is a branch of the thyrocervical trunk, which is in turn a branch of the first part of subclavian artery. It goes to the deep part of thyroid gland and supplies there. The third artery is the thyroidea artery, which is either a branch of the brachiocephalic trunk or a direct branch from the arch of aorta. Its duty is to supply the isthmus. Fourth arteries are accessory thyroid arteries. These arteries arise from the arteries which supply the trachea and the esophagus. All these arteries enter into the capsule and ramify around the follicles of thyroid glands to form the lobar arteries, which are the end arteries and supply there. Now let us see about the venous drainage. Deep to the true capsule, venous plexus is present. From these plexuses, three veins arise: superior thyroid vein, inferior thyroid vein, and the middle thyroid vein. Superior thyroid vein runs along the outer border of the superior belly of omohyoid and drains into the internal jugular vein. Middle thyroid vein runs along the inner border of the superior belly of omohyoid. It also drains into the internal jugular vein. Inferior thyroid vein, it drains the isthmus, descends downwards and opens into the brachiocephalic vein, mostly the left brachiocephalic vein. Sometimes a fourth thyroid vein drains the lower pole of the lateral lobes and opens into the IJV, which is called the vein of Kochek. It must be first looked for and ligated during surgery, as it is mostly missed and profuse bleeding occurs on its injury. Next, we shall see the lymphatic drainage. Around follicles, lymphatic plexuses are present which drain into the lymph nodes around it. Upper part of thyroid gland and lower part of thyroid gland drains separately into separate lymph nodes. Upper part drains into prelaryngeal group of lymph nodes which in turn drain into the jugulo-digastric lymph nodes. The lower part drains into pre- and paratracheal group of lymph nodes which drain further into jugulo-omohyoid lymph nodes. The nerve supply. Parasympathetic nerve supply is by the vagus nerve and the recurrent laryngeal nerve, whereas the sympathetic nerve supply is by superior and inferior cervical nerve plexus. Applied aspects. Ectopic thyroid. This is where the thyroid develops elsewhere during the descent. glossal cyst or fistula. Remnants of the thyroid gland remain elsewhere while descending, and cyst forms if the cyst opens out into the neck. It is called a fistula. That's all for today's class. Hope you all liked it. Thank you.